You can now buy a test that analyzes your risk for breast cancer, and you can do that test at home. Today, the Food and Drug Administration gave Bay Area company 23andMe the okay to sell a test directly to consumers. Now, it detects 3 mutations in a common type of breast cancer gene. And earlier on the 4 on 2 on KTVU, we spoke to Kathy Hibbs of 23andMe about just how this genetic test works.
You spit into a tube, send that tube to us, and it's processed through a laboratory, and then we return the information to you through your account.
Hibbs says it takes about 4 to 6 weeks for those results to come in. The test costs nearly $200. The FDA says there are many mutations, though, that the test does not detect, and it should not be a substitute for going to the doctor. Joining us now is Dr. Larry to talk more about this at-home test. And that was something that you and I were just talking about. This doesn't replace discussing and making important decisions with your doctor.
Right. So usually before genetic testing like this, we talk about it beforehand. What if it's positive? What if it's negative? What does that mean? Are we going to do more testing? And then afterwards. One of the things I worry about with this is you send this off in the mail, you get the result. Who are you going to talk to about this? How are you going to process it? You know?
I think that's one thing that makes people a little leery about this, but also perhaps the false hope that it might be giving to people if they take it and it comes back negative, because in reality, it's 3 mutations we just mentioned, but what, there are like more than 1,000 mutations out there?
For this BRCA 1 and 2, there are, like 1,000 mutations, and this is only 3 of them. BRCA 1 and 2, it's only like 5 or 10% of breast cancers. So if you're negative for this one, it is not the case that, you might not still be at risk for breast cancer. You still got to do your mammograms and all that stuff too.
Yeah, obviously, though, this is important. I mean, the ability to be able to take a test at home to give you some insight, but it's not the end-all, be-all, right?
Yeah, no, you're right. I mean, the FDA kind of clearing the way, it makes you wonder what's next, kind of direct to consumers, cutting out doctors. And on the one hand, I like that people can, be empowered and get this test done. It's cheaper than the $4,000 better test that's going to run more of your, of the genetic sequence there. So that's a good thing, but it still comes with some concerns and some caution.
And what about for people at home who are watching this, who think, okay, maybe I'm a woman, I'm over 40, should I take it? Do you think it's something that they should do?
I think the average person, the average woman who's concerned about breast cancer should really do this with caution. There's a specific person that I think it may be good for. If you're, if you had a first-degree relative, mom or dad, because this is passed on, it's hereditary. If they were positive for one of those 3 that this tests for, this might be a good test. $200, you can find out yes or no. Still, you want to talk about that with somebody. But outside of that, I'm not sure where this test really fits in for the average woman. I would hesitate. I would not tell everybody to get it, precisely because of what we just talked about. What does it mean? It doesn't mean that you don't have to forget about breast cancer or that you're not still at risk.
And when you're looking at this from a doctor's perspective and what the FDA is sort of approving, not approving now, does it concern you that perhaps the FDA might be a little more laxed in their approval process? I mean, I know that in years past they had denied something like this because they said it can't detect all breast cancer, right? And it might be providing some people some false hope, might be a little deceptive.
I think there's going to be a spectrum, right? There are some things that we're going to find out. There'll be some negative consequences, but then on the other side, it may help some people. So time will tell.
All right. But as you mentioned, even if you do this sort of genetic testing, always important to talk with your doctor.
Definitely.
All right. Thank you so much, Dr. Larry. Good to see you.